Muhammad Munir is a virologist at Lancaster University. Muhammad, always great to have you on the program. You've been telling us about remdesivir for a few months now. What about other drugs that have been successful in treating coronavirus patients?
Well, as we stand now, I think the dexamethasone appear to be very good, especially treating the people who are in a critical situation and are really the sickest one. And I mean, like half of the people who are infected with the coronaviruses, they do need hospitalization, and half out of those who needed hospitalization, they went on to the ventilators. And it has appeared that dexamethasone can save significant proportion of those people. So it's certainly good news. And then, of course, the remdesivir, that is what we've been talking before. Hydroxychloroquine and chloroquine is probably now out of the game. So certainly what we are counting on is remdesivir and dexamethasone.
What about this warning from these scientists, about 240 of them from dozens of countries, saying that the WHO has not got it quite right in terms of how the coronavirus is transmitted? Tell us the difference between airborne transmission that these scientists are talking about and the respiratory droplets that the WHO has been talking about.
Yeah, so current guideline from the World Health Organization is that the coronavirus is transmitted through either close contact or through the contaminated surfaces. So, for example, if someone is infected, sneezes or cough onto the surface, that remain contaminated, and whoever get in contact will contract the infection. But we do know that, for example, when we sneeze, we shed more than 30,000 droplets. Those are ranging from the size of 50 micrometer to 5 micron, and that is depending on to the humidity. It can travel very long distances, and when it travel long distances, that is what we called airborne, because then it's stay in the air for longer duration. And based on one of the studies, this virus can stay in the air for 3 hours. So during 3 hours, whoever come across could contract the infection. So that is where now the jigsaw puzzle is, whether it is airborne transmitted or it is both the contaminated surfaces and the airborne.
Muhammad, this other issue that still has not finally been concluded, it hasn't conclusively reached any sort of scientific finding about immunity. I have read one study which showed that people who have contracted coronavirus, who have had COVID-19, that their antibodies in their system don't actually remain in their system for too long. Do we know yet whether people who have had it can get it again?
Well, we don't yet have conclusive data that can dictate that the immunity established by the first infection would be protective enough against the reinfection. However, given our knowledge onto other coronaviruses, we do know that the immunity in SARS, for example, remain very protective for at least 1 year, but some level of antibodies remain until 3 years. So I would be extremely surprised if the antibody level for SARS-2 would remain less than 1 year. However, it's still required to be determined for the duration of these protective antibodies. And one of the concern is that when we talk about the overall immunity in a population, there are always an outlier group within the consensus. So the general consensus is that the antibody responses would certainly be protective and remain for at least 1 year.
Muhammad, always a pleasure. As I said, thank you for sharing your expertise with us. Muhammad Munir, virologist at Lancaster University.